Hi, and welcome to the Successful Breastfeeding class. I hope that when you finish with this class, that you feel like you have a lot of good information about breastfeeding that can help you be really successful on your own breastfeeding journey. That's my goal. And I also want you to have an understanding of the resources and support systems that are just critical along this journey as well. So what I think would be best for you to do right now would be to jot down a few notes of some maybe negative things you have heard about breastfeeding or things that concern you about breastfeeding. And as you go through this course, look at what you've written down, and as you learn more and more, see if it has been shown that that's not a concern that you should have or not an issue that that is actually a truth about breastfeeding or a fact about breastfeeding. So good luck. I hope you really enjoy the course, and please feel free to reach out to me if you have any questions. Take care and best of luck. This section is all about the benefits of breastfeeding, but I think before we launch into that, it's really important to learn a little bit about breastfeeding, look at some of the numbers when it comes to the United States, and look at some of our current feeding practices here and recommendations. So in about the 1920s, we sort of started adopting a bottle feeding culture here in the United States where because of the marketing of formula companies, they were saying this is the latest and greatest. They wanted consumers to adopt these practices, and it was very effective. They said this is the way that your baby can thrive, and mothers and families bought into that and began bottle feeding formula rather than breastfeeding. In the 1970s was the lowest rate of breastfeeding in the United States. Since that time, we've actually begun to see quite a rise in breastfeeding rates, which is really great. And breastfeeding is kind of trendy now. It's something that many people aim to achieve. Worldwide, the natural age of weaning is about 3 to 7 years. So in cultures that did not adopt this bottle feeding, but breastfeeding has always been kind of the normative way of doing things, they do tend to have much longer extended breastfeeding than here in the United States. And there's a number of other factors that play into this. Of course, women with careers, it's much harder to breastfeed for that length of a period, and we'll talk about that in a little bit. So in the United States, there's about 5% of women who have primary lactation failure, and this would be when they don't make enough milk or not enough milk to sustain their baby. So you can see that it's a small portion of our population. Worldwide, it's even smaller, less than 1%. So what is recommended by the American Academy of Pediatrics? They recommend that breastfeeding is exclusive for the first 6 months, meaning that there's nothing additional that the baby needs. They don't need water in a bottle or formula as long as breastfeeding is going well. That breast milk is all that they need. Of course, there is a recommendation to supplement with vitamin D as well, which is usually not in significant amounts in breast milk, just as a side note. At around the 6-month mark, you begin to incorporate complementary foods, which is basically you can continue to breastfeed, but they'd also include foods because the baby's needs are higher at this time for various vitamins and minerals. The World Health Organization recommends that you breastfeed for 2 years or more, and the American Academy of Pediatrics recommends to breastfeed for 1 year or more. So based on those recommendations, let's take a look at the statistics here in the United States. So in the United States, 81% of women have ever breastfed. This would mean that they've begun breastfeeding, but maybe not continued more than, a few weeks or so. We also look at the statistic of exclusive breastfeeding for 6 months, which is about 25% of women. And this, of course, is very low considering that this is the recommendation by our major pediatric organization here. So, and then when we look at longevity of breastfeeding, so breastfeeding for 12 months or longer, 34% of women breastfeed for that. And so the difference between these two pieces of data is just that most likely in that first 6 months, babies were supplemented but then moms may have continued breastfeeding as well as supplementing up to that 12-month mark. Now, longevity of breastfeeding can certainly be affected by women having to go back to work. And this is something that we don't do well here in the United States compared to other developed countries, is providing enough support and time off or paid time off for women who've just had babies, or for dads as well. So that can affect our breastfeeding rates. Also, just early support from a professional, from a lactation consultant, either at the hospital, at a birthing center, at home. Any of these settings, we are just not able to provide enough support for moms who really need that. So what are some of the benefits of breastfeeding? So for the baby, it's the optimal nutrition. It's everything that they need to sustain life for the first 6 months, which is their major growth period. It's also ready on demand. It's at the right temperature. There's no heating needed. It promotes bonding and attachment with the mom. And the mother's milk matches more than 50% of the baby's genetic material. So it is literally the perfect food for this baby. It is food that matches the baby's genetic material. It's meant to be fed to that baby, and it's specific to that baby. It also contains a lot of components that help with immunity. So there are components in breast milk that actively will bind pathogens, so they reduce the availability of pathogens food source. So this helps, of course, keep the baby healthy. It targets antibodies that are transferred from the mother, which results in a reduction. It has targeted antibodies that are transferred from the mother. So the mom's antibodies actually help to build the baby's immune system and trigger that immune system so that it can help to fight disease when this baby's immune system is immature upon birth. And it also helps to optimally promote GI health or gastrointestinal health. So it speeds up the passing of meconium because breastfeeding and the sucking reflex has a laxative effect. It also decreases colic and gassy symptoms. Babies who breastfeed tend to take in less air, so they may not burp as readily afterwards, but they may not need to either. So that creates less gassy symptoms. It also provides a protective coat in the GI tract, which can be protective against necrotizing enterocolitis, which is a very devastating gastrointestinal disease that can affect especially premature infants. So what are some more benefits to the baby? So it can help with oral development. It promotes jaw and muscle strength and palate growth. It reduces dental caries, which helps the teeth to develop properly without decaying areas. It helps with reduction of speech problems, and it reduces the risk of SIDS by about 50%. So, and this is just because babies who breastfeed tend to be more arousable when compared to formula-fed babies who don't wake up quite as readily as they're supposed to. Their normal sleeping patterns are kind of affected by being fed something that is not their most optimal thing to be fed. And then it reduces risk of developing allergies. So breastfeeding would be a specifically important thing to do for a baby who's born to a family who has allergies on both sides. This can really help. It can reduce risk later in life of chronic diseases such as diabetes, obesity, colitis, and Crohn's disease. It improves acceptance of a variety of different foods from 6 months into adulthood. And the reason for this is because breast milk, because it's made by the mother's body, the mom is eating all sorts of different foods. And so as she eats foods, the breast milk does change in flavor day to day. Whereas formula-fed babies are used to just one specific flavor, so their taste sensations are not being developed kind of in the same way that it would be when you have this different flavor each time you feed. And then we do see in studies that breastfeeding improves intelligence, so IQ scores have been increased in babies who are exclusively breastfed. So some of the benefits to the mother is it's convenient, it's ready to serve. Again, there's no heating of bottles, there's no preparing formula, there's no excessive washing of all of these bottles and pump parts or bottle parts. It promotes bonding and attachment with the baby. It empowers mothers. So it makes you feel like, this is what your body was meant to do, and you're doing it, and you're literally, your body is keeping your baby alive. It is a pretty empowering feeling. It also helps because of these two hormones that are involved, prolactin and oxytocin. It helps with to reduce stress and promote calmness. And this is a really helpful thing as a mother. And it's something that helps. They're actually called mothering hormones because they actually help you to be able to relax, to be able to enjoy being with your baby. And then they decrease breastfeeding decreases postpartum hemorrhage because it stimulates uterine contractions, which can actually be uncomfortable at first, but it actually helps your body to return to its normal state more quickly. It helps to get that uterus back into its kind of regular shape and after childbirth. And then it lowers disease risk for the mothers as well. So it lowers risk of breast and ovarian cancer, heart disease, osteoporosis, and multiple sclerosis. There is less time lost in career for mothers who do go back to work because of this increase in immunity in their baby. So there's less illness for that baby. So there's less time lost for a mom in the career or for a family in the career. It increases energy expenditure. So basically you burn calories just making milk. And the calories that you have to consume to maintain your weight during breastfeeding are actually higher than during pregnancy. So great news, moms. This also, breastfeeding also increases child spacing. So this could be a natural birth control method. Is breastfeeding can extend the time that you're fertile between children. The benefits to a partner and family. So it leads to a healthier mom and baby. So that reduces workplace absenteeism for a partner as well. It produces less offensive smelling diapers. Huge plus for dads and partners who are on diaper changing duty. And the cost of breast milk is free, of course. So formula can range from $1,500 to $4,000 a year. Huge cost for families. If you're on a specialty formula, it could be even more than that. That's a huge cost when breast milk is free. So that alone could be a selling point. And then the convenience, the reduction in sleep disruption. There's no bottle preparation, warming, and cleaning. That's also helpful for a partner and families too. And then when we look at breastfeeding from the societal perspective and the benefits there, it reduces waste in production, shipping, and packaging, decreases use of water and fuel for mixing the product, heating it, cleaning bottles, nipples, decreased use of environmental resources, so chemical fertilizers for the soy if you're using a soy-based formula, or overgrazing of land by cattle if you're using a cow's milk-based formula, which are the two most common formulas. And then there's decreased healthcare costs, decreased employer costs because of this, the immune boosting properties. There's also increased bonding, which can lead to more functional family units, increased IQ, which can lead to overall a more intelligent society, and decreased pregnancy rates due to naturally occurring child spacing and breastfeeding that we talked about as well. So that just covers a number of the benefits of breastfeeding. Breastfeeding is the body's design. And I want to start by just reviewing some of the basic structures of the breast so you have a better understanding of how milk is made and how breastfeeding works. So I want to start by looking at these alveoli back here. Okay, so the alveoli are the portion that actually produces the milk and secretes the milk. Once the milk is secreted, it goes up these ducts, through these milk ducts, and heads towards, this almost looks like a tree back here, it heads towards these branches of the tree, up to the nipple, ultimately. And the nipple has about 5 to 15 openings for milk ducts on the nipple, and this picture doesn't show all of those openings, but that's about how many they have for the average mom. And this darkened area here is called the areola, okay? And these little bumps all over the areola here are called Montgomery glands. And usually during pregnancy, you will see the areola become much darker. maybe larger, and you'll notice that these Montgomery glands are more prominent. Now, the Montgomery glands their function is to clean and lubricate the breast. So they kind of keep the breast clean. And there is a thought that they smell kind of like, they secrete a smell that's similar to amniotic fluid, which in the breast perfect design, this would cause the baby to, know where the breast is based on smell, based on that familiarity of that amniotic fluid smell. And then the rest of the breast here, this is just supporting fat and tissues as well. So I want to look at the stages of lactation and talk about what you can expect as you begin your breastfeeding journey. So mammogenesis is the first stage, and this is when there are breast changes that are brought on by the hormones of pregnancy. So generally women will see an increase in the size and the weight of the breast. They may feel breast tenderness in the first trimester, and for a lot of women, this is the first sign that you're pregnant, and then you take that pregnancy test and, you're pregnant. So that can be kind of a very first sign that your breasts are becoming ready to breastfeed. Then, as I mentioned, the increase in size and the darkening of the areola. The next step is lactogenesis stage 1. So this is when milk production begins in the cells, and this happens at about 10 to 14 weeks gestation. So the colostrum is available to the infant at delivery with high levels of a couple of compounds that help with immunity. So the key part about this lactogenesis stage 1 is that you actually have milk much earlier than you think you have milk. So I always hear from moms, oh, I don't have any milk yet, my milk hasn't come in. Guess what? Your milk came in at 10 to 14 weeks gestation. Okay, it comes in at a very low volume because the baby doesn't need it yet. And even after they're born, the baby's stomach is very small for the first few days, and then it gradually and incrementally grows from there, and they need more volume. And that's just how your body is designed to work as well. So the next stage is lactogenesis stage 2. This is triggered from the placental delivery. And this is actually the time when your body is triggered, okay, we need to increase that milk volume. So the milk volume begins to increase around day of life 2, 3, 4. And lactogenesis stage 3 is when your milk production is stabilized, which is around 2 weeks of age. And that's stabilized so that you're producing larger volumes for that baby. The final stage is involution, which happens about 40 days after the last time you breastfeed, and your breasts return to kind of a pre-pregnancy state. At that time, they're not making milk anymore. Something really key that I want to point out as well is in lactogenesis stage 2, before you've hit that point at about 2 weeks where your milk production is stabilized, you have this period from birth to 2 weeks where it's very important that breastfeeding is going well. It's not always gonna, go well straight from the first feed, but that's the time to really seek support if you need it. This is a calibration period when your body is learning, oh, how much milk does this baby need, and how much should I produce in response to their how many times they feed. So it is a really important period too. So why do babies suck so much? I know this seems like kind of a harsh statement, but I'm actually talking about their physical sucking. Why do they suck so much? Why do they, you see them suck at their hands, which is a normal infant behavior. You'll see them, of course, sucking at the breast, sucking on a finger. They'll suck on anything. So the infant goal with sucking is that they're born full of poop, and they need to poop out that meconium. If they are not pooping out that meconium, they are not getting rid of the bilirubin, which is something that causes jaundice in them, okay? Also, sucking is soothing, and it's a pain reducer for the newborn who's just been through an ordeal themselves, okay? So although birth is natural, it's still, there can be some pain for the baby as well, depending on how the birth goes. Also, the maternal goal is that sucking can increase prolactin, which helps to trigger the body to increase their milk supply. So it's really important from the mom's perspective that the baby is sucking and sucking well. So what you see is a colostrum, which is the early milk, and the primary purpose of the colostrum is that it has immunological protection. So it's very high in antibodies. It helps to protect the newborn. They have an immature immune system, and this helps to really kickstart this immune system. The colostrum is definitely liquid gold. All your breast milk is liquid gold, but this colostrum is truly liquid gold. It's very low volume. You're not going to get ounces of colostrum, but what you get is concentrated nutrition designed specifically for your newborn. This section is all about positioning and latch, but before we get into the nitty-gritty of that, I want you to know some hunger cues so that you can tell when the baby needs to feed or when they're telling you that they're hungry. So the first thing that you might see is babies do sleep a lot, so you might see them begin to stir after a rest. They kind of get their body wiggling a little bit. The next thing that you might see is what I call look and lick. So essentially their eyes are squinting open and they're looking left, right, and they begin to lick their lips. That's a common thing that you'll see that will tell them, hey, they're looking for mom. The next thing that you see is a rooting reflex, which is typically in response to a stimuli on the cheek. So it could be a blanket that they feel close to them. It could be their own hand that they're bringing up and they're trying to open their mouth and latch onto their own hand. So that's rooting, and that's a good sign that they're hungry as well. The last sign that you might see is crying, and this is really a late sign of hunger. It's much more difficult to latch a baby who is crying and frantic because their tongue is elevated, and you really need their tongue to be at the base of their mouth in order to properly latch on. So it's important not to let your baby get to that point of hunger. And I know that there's reality and there's the ideal. So just doing your best you can to note the early hunger cues is really important. So the next thing is that your baby has a rooting reflex. This can help them locate the nipple, and I already spoke to you about rooting. The other reflex that they have is a sucking reflex, which is observed when they're in utero at about 15 to 18 weeks gestation. So there's a nutritive suck, which is coordinated bursts of sucking and pausing and self-starting, which is what you really want to see at the breast. And then there's non-nutritive sucking pattern as well, which is fast and shallow sucks with little or no swallowing. So this can be used in the beginning of the feeding to get the mother's milk flowing, and then you'll see a more nutritive suck. So really these work in combination with one another, but it's something that the baby's been practicing for a long time inside of you. The next one is a swallowing reflex, of course, and then a gag and cough reflex help them to protect the airway. So I want to show you a video which is called the breast crawl, and it shows how the baby can actually self-attach just by use of their own reflexes after birth. So this baby was just born, and you can see that this baby is doing some really coordinated movements with the legs. This is why it's termed breast crawl, is because the baby's legs are moving and that looks like a crawl as they try to locate the breast. This baby, you can see the rooting reflex already. The tongue is moving, the mouth is moving, the hand is groping to feel for the mother's nipple. And now you can see the baby has found the nipple and is trying to self-attach. And this is with no help from the mom. So you can see it's a very instinctive process for the baby to try to latch on. Whereas women, it's a learned behavior. It's important for us to see other women breastfeeding to kind of make that the norm, but for babies it's very instinctual. So this visual here is from La Leche League International, which is a great organization, breastfeeding supportive organization, and what they show is a few different positions that you can do with babies. So this part will really help if you have a baby doll, a toy of any kind. In a pinch, you can use a sack of flour. It's about the same size as a newborn. It doesn't wiggle as much. So what I'd like you to try is we're going to try a few different positions. It's just to get you a little bit comfortable with what you're going to be trying to do when your baby is born, what kind of positions might work for you in developing a bit of a comfort there. So the first position that we're looking at over here, this first position up here, is what is called laid back breastfeeding. And it's called laid back breastfeeding. You can see the mom's in a really comfortable position. The baby's at breast. It's similar to what you just saw in the video where the baby had crawled to the breast and the mom was laying on her back. This mom is a little more upright, but the baby is laying on its stomach, which is a position of comfort for a baby. It feels good to them to not be on their back at first. And I know that we put babies on their back for sleeping. That's something different. But you'll notice with your baby when you start doing diaper changes and things, they will have a startle reflex when they lay on their back. And it's where their arms go out to the sides and kind of like wiggle around a little like that. So this is a really great position. It can be a little tricky for new moms or moms who have a lot of soreness at first to be able to latch their babies like that well. These other positions provide a little bit more support, which can be good for a newborn. Remember, the head and neck are not very strong yet, so it can be helpful to have a bit more support. So this position here is called cross cradle. And what you'll notice is that the arm is going up the back of the baby's spine, the baby's back there, and the fingers come to rest at the base of the baby's neck. So there's no holding the head against the breast. It's more so just having the baby's head supported with the hand at the base of the neck, so the baby can still pull off when they want to. That sort of thing. This position, and this is my favorite, cross cradle is my favorite to latch new moms in most situations, but football hold can also be helpful too. This next one is a cross cradle, a cradle position, and it's similar to the cross cradle, except your arm is kind of around the baby's head. I find that for newborns, this position is not always as supportive because, again, you don't have the hand running down the back of the baby and supporting at the base of the neck. Football hold is also a good supportive hold for this, and here they call it clutch hold. A lot of people call it football hold. You basically have the baby on the side of you, and this helps moms to see a lot better. That's one of the key helpful aspects about football hold, is that they can actually see the baby's face a little bit better, see what the mouth is doing, and see the breast a little bit better. This position here is called side lying position. It's also a great position, but again, can be a little bit tricky for a newborn. So I'd like for you to take a second and grab your toy, your baby doll, your sack of flour, and let's try out a couple positions. So here's my baby. So the first position that would be helpful for you to try would be the cross cradle position. So as you can remember, you have the baby across your body like this. Your arm is running up the baby's spine to the base of its neck, and you're actually kind of holding the baby behind the ears. This would be harder to pull off with your sack of flour, but still worth a try. So what it looks like is you have a very supportive, you have your arm down the length of the baby's body, so you can have a lot of control here with how you position the baby. Next thing is that you want this baby tummy to tummy, and that would be basically the baby's on its side. Essentially, that's what you're looking for. So you have the baby in one hand here. The other hand you can use to actually sandwich the breast. And what you'd like to do with the breast is actually think of it as a hamburger. So if I'm going to eat a big hamburger, I'm going to squeeze the hamburger and take a giant bite. And that's exactly what you want your baby to do at the breast, not take a giant bite. I'm not crazy. I would never wish that on anyone. But you want them to get a lot of breast tissue in their mouth so that they're not tugging just on the nipple. That can do a lot of damage. So you would have the baby like this. You would sandwich the breast with this hand. And then you would try, as the baby opens up, you can rub the nose, rub your nipple from the nose to the lip of the baby, and this will stimulate them to open wide and take a lot of that breast tissue in. Okay, and then during that feeding, you can kind of loosen up this hand if you want. That's more of a latching technique, and just let it fall comfortably around the baby, or just on a pillow next to you, that kind of thing. So definitely feel free to stop the video at any time to practice these positions. They'll take a lot of practice now, a lot of practice once you actually have the baby as well. The next position, and we can actually keep our hands in the same style here, because we're just going to take the baby, we're going to slide the baby to the side. And this is called football hold. So the baby is actually, again, still on its side. The tummy is more to your side now. So what it's going to look like is more just you're seeing the baby's head, and the rest of the body is kind of around the side of you. So I'll try to give you a little bit of a better look. It's like I have a little football here, right? So tucked body is, you know, again, your arm is down the spine for a lot of support. You can pull your elbow closer into the baby and pull them closer to you, which can help to provide a lot of comfort too. And same thing here. So you're going to use your opposite hand. You're going to squeeze your breast far back from the areola. So you want to leave the areola pretty much exposed to the baby, but squeeze the breast, create a sandwich, and then have the baby latch on there. And then this positioning is like that. So that kind of gives you just a couple positions. Feel free to try the other positions as well. And once you have your baby, you'll decide what's comfortable for you guys and what feels natural for you guys. The next positioning is one if you have twins. So this can be really tricky, as figuring out what to do with these two babies. So this is a few different positions with twins. I will tell you a really key approach with twins, especially in the early days, is breastfeeding them one at a time. And the reason is because for the moms, again, breastfeeding is a learned skill, so it does take some practice to get really good at it. Also, each one of your babies may have a different strength or ability to latch well, and this can really help for you to focus on them individually in the early days, and then ultimately go to where you can breastfeed them both at the same time. And this will, of course, save you a lot of time, but at first when you're learning, it's really important to kind of latch one at a time. All right, so now we're talking about the latch, and this is a great graphic that I got from unboundbirth.com. It is so helpful in showing what the goal is with the latch. Now again, you'd want to make sure that your baby is getting as much breast tissue in their mouth as possible. This is going to help feel a lot better for you. It's going to help it be more comfortable for you. It's also going to help them to get a lot more milk. So both, you know, it's a win-win there. So the first thing to kind of keep in mind is that we tend to focus on, oh, get the nipple in their mouth, get the nipple in their mouth. Now, you don't want to focus as much on the nipple. Yes, we want the nipple in their mouth, but the nipple actually has to get to the junction between the hard and the soft palate, which is pretty far back in the baby's mouth. So if you feel with your tongue on the roof of your mouth, you can feel where you're at the roof of your mouth that your palate is very hard, and then as you slide your tongue further back in your mouth, you can feel that it starts to become softer, a softer padded part, and that is the junction between the hard and the soft palate, and that is where the nipple has to be in their mouth. So it's really important that they get a good amount of tissue so that there's not a lot of tugging on your nipple. So the way to do this is to, one, get them to open really wide. The second thing is that you want to kind of sandwich the breast. So you can see in this graphic here, this woman has her hand here holding the breast, and she's kind of squeezing the breast. Again, picture a hamburger, picture a big sandwich. You have this big sandwich that you're trying to get into your baby's mouth. Now, the baby's mouth, the baby is going to approach it sort of with the bottom jaw, and get a lot with the bottom jaw. So you want to make contact pretty far back here. For a lot of women, it's close to the edge of the areola. And then you want the baby to really come up and over the nipple and get some with their upper lip. And in this diagram, it kind of looks like The nipple is one of the last things to enter the mouth, which is not what people think about, but this is actually helps to facilitate a more comfortable latch. So really important information here. Then once you do have the baby on, you can see that the baby's tongue is actually underneath the breast. It cups the breast, creates a seal, and that's how milk is transferred. And then each of these lips are rolled out, and you want to think little fish. So you want to be able to see that your baby's lips are rolled out like they're a little fish latched on, but you want to see that their jaw is very wide and that they've taken in a lot of breast tissue as well. So these are the things to kind of help get that latch more comfortable, and that is a tricky thing to learn. That is a thing that moms are challenged with all the time. So I want to show you a picture here of two babies, and I want you to, I'll give you a second to inspect these pictures, and I'd like you to tell me which baby you think has a better latch. And I know it's just, it's a picture, so you can't see the whole thing here, but based on what I was telling you, what the things to look for, try to tell me who you think has the best latch here. Okay, so let's look first. I would imagine that a lot of you thought this baby on the left here had the best latch. It is common for babies to close their eyes when they're feeding, but what I see here in this picture is that I can't really see the lower jaw here, which makes me, or in the lower lip here, which makes me think that that lower lip is rolled in, that it's not out as much as it should be. It also, this baby looks very tense. The baby has his hand up here. It's not a relaxed position, though the eyes are closed. This is not a relaxed position. And because I can't see that lip, that looks like that might be a painful breastfeeding position without those lips flanged out. Now this baby over here, looking up at mom, looks a lot more relaxed, though the eyes are not closed. This is also a common thing that you can see, especially once the baby is closer to a week old. They may have some of the feedings with the eyes open. Their eyesight is starting to become a little bit better, and they can certainly have been able to see mom at that short of a distance for their whole time since birth. So what I like about this baby here, what I like about the latch, is I can see that the lips are rolled out, and that's even the lower lip there is rolled out. So that is helpful as well. And then the baby's jaw is pretty wide, so you can see that the baby is opening their mouth pretty well. This bottom lip is rolled out here. So just a couple of things to kind of think about when we're talking about positioning and latch. One of the trickier things about breastfeeding is trying to look for the signs that your baby is getting enough. Now, it's very easy when we're comparing breastfeeding to bottle feeding to put an ounce in the bottle and know that's what your baby took. However, it's more difficult to quantify the volume that your baby is taking at the breast. That being said, there's a lot of really good strategies and objective ways that you can tell that your baby's getting enough, and I want to go over those with you. So the first thing that's really important to understand is how small the newborn's stomach capacity is when they're first born. So most people think of volume of breast milk in ounces, but at first it's a very tiny amount they need. Their stomach is about the size of a cherry, and they only need about 1 to 1.5 tablespoons per feeding. So this is obviously a very tiny amount volume-wise, but it's very important too. We talked about the colostrum and the value of the colostrum, how important that early milk was. It doesn't come in a large volume, but it's very good for the baby's immune system. It's very good in coating the gut, protecting the gut. By day 3, their stomach is about the size of a walnut, so a typical feeding would be about 22 to 27 mLs, which is just shy of an ounce. So still not talking in ounces yet. And then by the first week mark, their stomach has increased in its size as well and the capacity that it can handle. So a normal feeding at that time would be about 45 to 60 ml. So that's about 1.5 ounces to 2 ounces. By the first month, the baby's stomach is larger, about the size of a large egg. and it can handle about 80 to 150 mLs per feeding, which is about 2.5 to 5 ounces, and that will depend on the feeding, depend on the baby. But obviously a huge change from day one to the first month. So here are some good ways to tell if your baby is getting enough and some objective signs. So first of all, the frequency of feeding. You want to shoot to feed your baby 8 or more times in 24 hours. For a lot of families, this is not going to be any regular pattern. So in the beginning, babies tend to be awake more at night and sleeping for longer stretches during the day. So more of the feedings may be happening in the nighttime. But however it is, it's a good idea to record these feedings and record wet and poopy diapers. And for feedings, definitely make sure that you're feeding 8 or more times in a 24-hour period. For wet and poopy diapers, so anything going in is coming out. So that's, we celebrate wet and poopy diapers. And it's really important to kind of know what your goals are. So you want to have a goal of 1 wet diaper for each day old for the first week. So you're shooting for essentially 1 wet diaper on day 1, 2 wet diapers on day 2, same thing with poopy, 3 wet diapers on day 3, 3 poopy diapers on day 3, day 4, 4 wet diapers, 4 poopy diapers. On day 5, 5 wet diapers, 5 poopy diapers. And day 6, 6 wet diapers, 6 poopy diapers. And this will continue on where you want to have at least 6 or more wet and poopy diapers until about a month of age or so, when the baby will stop pooping quite as frequently. So that's just kind of a general thing to shoot for. Again, that can be a really effective way of knowing if your baby is getting enough, if they're able to achieve those wet and poopy diaper goals. So the other thing is that you always want to look at the poop. And I know this is not something that you've done probably before, kids, but get used to it. So the stool is going to start as this very black, dark meconium stool, and shortly after birth, they'll have a few stools that are that meconium color, and then they'll begin shifting to this dark brown color, and then eventually you'll see kind of more of a greenish color, and then you'll start to see a yellowish and less thick. And eventually by about day 4, day 5, you want to see this mustardy yellow color, and it's usually looks seedy, or like it has some texture to it, but it's relatively thin, somewhat watery. So, and then for suck patterns, this is another really effective way that you can tell if your baby is getting enough. So in the early days, when there's not a lot of volume, the sucking pattern is different than when there's a larger volume. So what you want to see in the first few days of life, in days about 0 to 3, before the mom's milk has really increased in volume, you want to see that the baby has a sustained sucking pattern, that they pause, they self-start, and you will hear some audible swallows. You won't hear a ton of swallows like you will after day of life 4 when the volume has increased, but you should hear some swallows. Day of life 4 and more, you want bursts of sucking, and then you want to hear the suck, swallow, breathe pattern, which often sounds like a little puff of air, a little pop of air. And the baby will still pause and self-start, but you'll see longer sustained bursts of sucking and this pattern of suck, swallow, breathe. And I want to give you an example of this, show you this video quickly with that. So this is a baby who is 2 days old. And this video is from Jack Newman's website. He's a great expert on lactation and breastfeeding, Canadian physician. So this baby, what you can see is this baby is doing this typical pattern that you'll notice in the early days. So they're doing a sustained sucking pattern with pausing and self-starting. So here the baby's sucking, pause, and now back into that sucking pattern. And pause, and begins to self-start on their own again. So you want to see that. A lot of babies are very sleepy in the early days, and that is normal too, but you definitely want them to be active and working at the breast like this baby is doing. So the next objective way to tell if the baby is getting enough is to look at what the baby's weight changes tell you. So it is important to know that all babies lose weight in the first few days. So I have had parents panic calling me that their baby had lost weight when that is actually very normal. The key thing is that you don't really want the weight loss to be more than about 10% of birth weight. So 10% and even a little lower than that, 7% may indicate that that breastfeeding is not going well. It's not that it can't be turned around. It's just that maybe you got off to a rough start and the baby had more of a weight loss than you typically like to see. However, the other threshold on that is if the baby did have some early weight loss, you really want them to get back up to birth weight around day of life 10 to 14. So that's the goal, is that you want them to be up to birth weight at that time for all babies. So what you want to see is about a 5 to 8 ounce weight gain per week for the first 3 months. And this equates to about an ounce a day, or just shy of an ounce a day. So you really want to see, you will see that weight loss in the first few days, but then after the mother's milk has increased in volume and the baby's stomach size has increased in capacity, then you should see a steady weight gain of about an ounce a day, or just shy of an ounce a day, up until the first 3 months. So about from day of life 4 or 5 until 3 months. Other ways that you can tell if the baby is getting enough is to look at the baby's demeanor after feeding. So you really want to see that the baby seems satisfied after most or all feedings. You can also tell if your breasts feel full before the feeding, and then they might feel softer after the feeding. And this is something that can definitely be observed after your milk really increases in volume. It's a little harder to tell before that, about third day or so. And then you also can see things like milk dripping from your breast, or milk inside or around your baby's mouth. That can also give you kind of a subjective sign whether they're getting enough. And then it is a normal pattern too for women to nurse a baby with one or both breasts. So some women do one breast per feeding. Some women do, right breast, left breast, and then the next feeding they'll start left breast, right breast. So it is always, I always hear from moms, well, how do I know it's time to switch? Or, how long should I be feeding my baby for? And this is a really tough question because babies don't tell time. They are not driven in that same way. So it's not as important to be timing them, but it's more important to be looking at some of these objective and subjective things during the feeding to try to determine if they're actually being productive at the breast and if they're transferring milk. So those are some really good things to look for when you're trying to figure out if your baby is getting enough. In order to ensure that you're successful with breastfeeding in the early days, I would really suggest that you create a plan for yourself. So whether you're birthing at the hospital or birthing at a clinic, birthing at at your own home, whatever it may be, have a plan in mind for what you want to happen immediately after birth. So some important things is that immediate skin to skin is very helpful. This helps to elicit the instincts of the newborn. So the rooting, gaping, stepping, that breastfeeding push-up or breastfeeding crawl, sucking, and it helps to take advantage of the short wakeful period that they have that immediately follows their birth. Often after that period, they become more sleepy, may sleep for a longer period of time, and then we'll get onto a pattern of feeding every 2 to 3 hours from beginning of feeding to beginning of feeding. So it's really important to take advantage of that immediate wakefulness that they have. It's another great reason to make sure that you're not separated from your baby for until the first breastfeeding is completed. So ideally you'd want to to do this within the first hour of birth, and then you'd want to make sure that you hold off on things like height and weight immediately, which sometimes at the hospital there's a big push to do the height and weight first and then put them on you, and it's not necessary to do that. Their weight is not going to change in an hour or two. It's just be clear about what you want. Another thing to insist on or to look for a hospital that promotes this is rooming in with your baby. So you really want to not have any separation from the baby in the first couple of days. You also don't want any pacifiers, bottles, or teats. They can interfere with breastfeeding and make the baby, and some babies, they will become preferenced as to a certain feel, a certain mouth feel. And that can make breastfeeding more challenging. Also, there are some situations where it is medically necessary to supplement the baby. So some examples could be when there is separation due to maybe a maternal illness, or when the baby's really struggling and unable to latch on, and their mom's unable to express any milk, or certain medications. But in most situations, supplementation should not be given unless there's a real medical necessity. So that would be something key to include on your plan. And then if separation is necessary, you want to begin pumping right away. So you'd want to pump within the first 6 hours and then pump every 2 to 3 hours or 8 or more times in 24-hour period. So this is really important to make sure that you're still getting your supply going. You're making sure that you have something to feed the baby, but also, that your supply is not a problem moving forward because of the lack of stimulation early on. So it's really important to kind of make sure that that you get that going as well, even if you are separated from your baby. And then the question of circumcision. So for boys, the thing about circumcision is, because it is done really early on here, the hospital stays are very short, especially with a vaginal birth, and many families, physicians will try to get that circumcision in, if that's the wish of the parents, prior to discharge. What that means is that it's done very early on for the baby. Now, it is a parent's choice, of course, what route you want to go with this. The important thing to know about how this affects breastfeeding is often the baby, because they do experience some pain with that, the baby is usually given something sweet to suck on afterwards, and given a pacifier to calm them. And then they often sleep for a much longer period to kind of sleep off that stimulation, that pain, and that can interfere with breastfeeding, especially if breastfeeding is not going really great at the start. So it's just something to consider. As a parent, if you do want your little boy circumcised, then it might be something that you would want to wait for a week or so, or 2 weeks, until until the baby is more breastfeeding is more well established. The next thing to do is to think about your breastfeeding plan for when you get home. Skin to skin remains really important for the baby, as well as kangaroo care, which is baby wearing. So having that baby on you at all the time. This is truly the 4th trimester, and they want to be with you. They only know you. Remember, they've spent their entire life inside of your body, and now all they know is your smell, your feel, your warmth. So they really don't want to be away from you. Limit your separation, especially during the first 30 days, which is kind of the calibration period. So really limit how often you're separated from your baby. This can affect, if you're missing feedings and things, it can affect breastfeeding. It can affect your supply. Make sure you're pumping for any missed feedings, and I suggest that you try to avoid pacifiers and bottles for the first month, again, because some babies are more likely to get preference for that mouth feel. So my suggestion would be to go through, look at what things are important to you in the hospital, in the birthing center, at home, what things can support breastfeeding, what things are important to you, and include those things on your birth plan as well. and then come up with a plan along with your partner about what things you both can do to support breastfeeding at home. It is really important to separate the initial nipple or breast tenderness or sensitivity from actual pain. Breastfeeding should not be painful. There is some of that early tenderness. Now think about if you were sucking on your arm 8 times a day, 8 or more times a day, for indefinitely, for days in a row, and maybe for 30 minutes, 45 minutes at a time. Your arm would be a little bit sore. Same type of thing. So you might have that soreness, you may have tenderness, but breastfeeding really should not be painful. So it's important to try to separate that tenderness from that actual pain to be sure that there's nothing going on that is a concern. So I wanted to go over some common concerns of breastfeeding, beginning with conditions that present for mothers, and then discussing some features of mothers and infants that can present different challenges, especially in the early days of breastfeeding. So important questions to ask when there's pain, soreness of the breast or nipples. What type of it? What's the length of time that you're experiencing that pain? When is the onset? So does it start right at the beginning of the feeding? Does it start when the feeding has just ended? And how old is the baby? So one of the common concerns is thrush or yeast overgrowth on the baby. So this can present as a burning sensation on the nipple during or after feeding. And in the baby's mouth, you can see it as white spots or a white coating on the inside of the mouth or on the tongue. Usually during breastfeeding sessions, the baby will be irritable, gassy, they'll be on and off the breast, looking like they can't get comfortable. I want you to think of this differently than milk tongue. So milk tongue is something that you see in babies too, which is where there's a thin white coating on the tongue that can easily be wiped off, and it's just because of the milk that they're getting all the time. We're not brushing their teeth or anything like that because that's not a thing yet. So you may see that. Thrush is different. It's a thick coating. You can't just wipe it off. And you would see it on the inside of the mouth, on the tongue, and that sort of thing. And the mother's breast and nipple of a baby who has thrush and mom who has thrush, because you're going to share that, it would be very red. It looks kind of angry. That's a way to describe it, kind of angry, and it's very painful and burning feeling. Another condition that sometimes gets mixed up with thrush is called Raynaud's syndrome, which is a where stress and cold can trigger decreased blood flow, and we're talking about to the nipple specifically in this case because this would be in the application of breastfeeding. So what you see, you can experience the mother can experience kind of a burning sensation on the nipple during or after feeding, but the infant won't have the same symptoms as thrush where they're gassy, irritable, on and off the breast. It'll be just the mother's sensation. You might see a changing in color immediately after the feeding of a blue, white, or red discoloration of the nipple, or probably all three changing to those. And it just shows that there's a decreased blood flow to the nipple there, which can present as a burning as well. Another early on concern is engorgement. So engorgement is a congestion, an increase in vascularity in response to the delivery of the placenta and the increase in the volume of milk. So what this feels like is an overfullness in the breast, a tightness in the breast, and a pressure in the breast. And this is actually normal for your milk, especially if it's for a second baby, and you've already had some experience breastfeeding. Your milk usually comes in with a vengeance, and it comes in that way because it's trying to meet your baby's demand, and every baby's demand is a little bit different. But the concern here is that you could feel overfull, and the best thing to do in this situation is to hand express a little bit of milk, just for comfort, and then just make sure that you're nursing the baby as often as possible. Especially in those early days, it's really important to be taking that milk out so that your body makes more milk. The next thing is plugged ducts or mastitis. So what plugged ducts is that anytime that the milk is left sitting in the breast for too long, so if you're in this engorgement or this overfullness of the breast and you're not nursing frequently, or you're not pumping, or you're not hand expressing to get this milk out, the milk can stay in the breast for too long and it begins to thicken and harden in there. So what you would feel that as the mom is you would feel a lump or a sore, tender spot on the breast, which can in itself be resolved. Generally, we recommend light massage, heat to that area, of course, frequent breastfeeding, still hand expression to try to get that thickened milk out. But if you're unable to resolve it, eventually the concern is it can lead to mastitis, which is an infection of the breast, and it makes you feel like you have the worst fever of all time, and the worst flu of all time. You may know immediately that you are not well, and it can come on really quickly. So it's really important. You can still clear this up without antibiotics as long as you can remove that plug. But generally, once it gets to the stage where you have a fever, it's important to at least be thinking about, okay, I'm going to need to get antibiotics probably soon for this if I can't get it resolved. An abscess is a very rare ending to mismanaged mastitis, so this would be if you started antibiotics and then maybe you didn't finish that course and then you still had an infection afterwards, something like that, and it could end in an abscess. But that's very rare, and it means that something went wrong along your way to managing that plug duct and the mastitis. So another couple of common concerns that we see. So some challenges for the mom can be inverted nipples. So inverted nipples, you can breastfeed with an inverted nipple. An inverted nipple would be when the nipple is actually more internal, going kind of inward. And the recommendation is basically the same for breastfeeding. You still want to latch the infant onto a lot of the breast material, a lot of that areola. So having an inverted nipple is not a deal breaker whatsoever. There are also tools to kind of help with that too. Nipple shields are a tool that is used sometimes if there is trouble getting the baby to latch. But for a lot of moms, inverted nipples, you may think it's a challenge, but a baby can nurse with that as well. Another an anatomical thing is flat nipples. So flat nipples, same thing. The nipple is not raised or is raised only very slightly. And that, again, is not too much of a concern. It can be a concern in the early days of latching the infant on, but there are a lot of things that can help with that. And then another condition would be large or long nipples. So for large and long nipples, the really key part here is to see if the baby can handle that. There are some cases where the baby may not be able to open their mouth long enough for a large nipple, open their mouth wide enough for a large nipple, or a longer nipple might stimulate their gag reflex in the back of the throat because it's too large for the newborn. Usually, if you can maintain your supply, usually babies will grow to a point where they can handle a large or a long nipple, but this could involve some pumping in the beginning. And it just depends on how the mom and the baby pair. Some infant challenges. So there could be a tight lingual frenulum or frenum, which is a tongue tie. So this picture here shows the most classic type of tongue tie, where there's this piece of really tight tissue here, which is connecting the tongue to the floor of the mouth. So the baby's unable to elevate the tongue, unable to extend the tongue, and it's tightly holding the tongue in place. And what is typically done here is that the tongue is clipped or lasered so that the range of movement of the tongue, range of motion of the tongue is able to be able to breastfeed. So in this situation, it looks like this tongue is very restricted, so this would be a baby who would most likely have their tongue released, their tongue tie released. You see all degrees of this. There are posterior tongue ties, which are more difficult to diagnose, but it would be, again, a restriction, but you don't see that tight piece of skin there. There's also tight labial frenulum or frenums, which is a lip tie, which would be underneath the top lip, a very tight piece of skin that doesn't allow that top lip to roll up properly, and that can cause a more painful latch as well. And then, of course, we have cleft palates and cleft lips, which are a more difficult situation for breastfeeding. These often involve pumping, bottle feeding, and some specialized equipment in order to feed babies who have these conditions. In selecting a pump, it's important to make sure that you get something that's the right fit for you. You need to ask a few really important questions first. So you need to ask why you need the pump. Okay, are you going to be separated from your baby for school, work, travel, that sort of thing? Where will you be pumping? And what period of time will you be pumping for? Meaning like will you be pumping for a period of months, weeks, or just a few days here and there? So these are really important to figure out first when you're trying to determine what's going to work for you. There's a number of great pumps that are available on the market, and with the Affordable Care Act, many moms are getting these pumps for free through their insurance, which is really awesome and something that we haven't seen prior to this healthcare act. So some of the pumps that you could have would be a manual pump. So a manual pump is essentially a pump where you just hand operate it. So you're usually squeezing something, and you can just use one side, one breast at a time. This would be an appropriate pump for somebody who may not have to pump too often, but just every now and then you just pump a little bit here and there. It can also be for a mom who likes to have a little bit more control pumping. In general, if you're going to be away at work or on a more regular basis from the baby as they get a bit older, it's good to have a pump that can do both sides at once. So often people go for battery or electric powered pumps, which they can usually do both. And then the ones that are dual expression can pump both sides at once. So those are really great pumps as well. Another great tool is being able to hand express, and hand expression kind of mimics the pump in a lot of ways, or actually better mimics breastfeeding of the baby, because the pumps often how they're set up to work is that they just use suction in order to extract the milk from your body, whereas when the baby is breastfeeding, they're actually doing a lot of jaw movement, which is putting a pressure on different points on your breast in order to bring the milk towards the ducts on the nipple face to actually transfer milk. And hand expression does a better job. So with hand expression, you're kind of thinking milking the cow. It's a similar act. And I want to show you this short video from the stanford.edu website, which does a great job of showing you how to hand express. Now in this clip, Jane Morton is working with this mother to hand express her milk. So you see she makes a C with her hand, kind of around that areola, pulls straight back against the chest wall, and then moves her hands forward towards the nipple. Now here's another mom who is going to hand express. She does some light breast massage here, working with Dr. Morton. And then she's basically going to, again, create a C around her breast, and then push directly back against the chest wall, which is something really important to remember as far as technique. And this can be as important, especially in the early days, as important as pumping, because when you don't have a huge volume, it's more important that your breast gets that stimulation, and this more closely mimics an actual nursing baby. And it can also be more comfortable to moms, especially if you're having pain of any kind. So pressing back in that C and then rolling compressing towards that nipple to get the milk flowing out. And that can help, again, to keep your supply up. So a really important tool and technique. So some other equipment that can be helpful on your breastfeeding journey is in the top left here, I have a nipple shield. This can be helpful for a baby who is having a bit of trouble latching, so latch issues might help there. Sometimes this helps for preterm infants. Sometimes this helps for babies who have had a lot of bottles in the beginning, and they have sort of a preference to bottles at this point. So that's kind of some of the reasons that that might be indicated. The tool next to this, so right here, this is an SNS, or a supplemental nursing system. So how this works is essentially you put express breast milk or formula in here, and this tube goes down, and you can attach the tube. You can either finger feed an infant, like in the picture below here. You can finger feed an infant with this tool, or you can actually attach this to the breast of the mom and have this little tube providing additional supplement while the baby is breastfeeding. So this tool works really well for mothers who have a low supply. It could be due to a breast reduction, which can often cause a lower supply in a mom. It could be for preterm infants who are having a difficult time transferring milk. So they might need a little bit extra and get it a little bit faster. It could be for adoptive parents who, it's important, they want to breastfeed and they want that baby to have that closeness, but they haven't developed either a whole supply or much of a supply, so they're giving that supplement at the breast. Another picture here would be, so this one I mentioned was finger feeding over here. And then this picture here shows a baby being cup fed. This is another way in the early days that you can provide any type of supplement to the baby beyond nursing them. So if they're not nursing well, or they're not gaining weight on the curve that you like to see, you might have to give an additional supplement. It could be express breast milk or a formula. And it's often good to give it in a cup, because then the baby doesn't get that preference for the bottle. So this makes sense when the volume is much lower for the baby, and it is a technique that is used so that they don't become bottle preferenced. Advanced planning is really key when it comes to getting a plan together to return to work or school. It's important to explore all options as a family, as a mother, because you want to see if it makes sense for you to take an extended maternity leave. We know that extended maternity leave helps with breastfeeding. It helps with duration of breastfeeding. So it's important to consider that as an option. Working from home a few days a week, working part-time if you have flexibility in that way, having a caregiver bring your baby to work. These are all really great options to kind of extend that period of closeness you have with your baby. Sometimes these are not practical, and in that case it's important to just consider a plan for when you return to work full-time and will be separated from your baby. So I'd like to talk about all of these options, because most moms fall somewhere in the spectrum where they're trying to sort out what makes sense for the family. So the first thing to do is to discuss a plan with your teacher, boss, or whoever you report to. This is best if you can discuss it early and often. So making them aware of your situation. Hey, my baby's due this day. I'm going to take this much leave time off when I come back. I plan to be breastfeeding my baby, and I'm going to need a place to pump, equipment, whatever is practical for your setting. So you also want to look at your schedule and what you think you're going to come back to, and plan a break time and or lunchtime period to express milk, or have a caregiver bring the baby to you. If you're working close to home, that can sometimes be a good help as well. So if the baby is about 6 months or less, you definitely want to make sure that you have time to express 3 times in an 8-hour shift. 2 times is usually fine with a little bit older baby, so in that 6-month to 12-month period. And then it's definitely important to find out what your specific state law is. So some states are very specific about accommodation of breastfeeding in the workplace, and making sure that they do accommodate that. And other states have a breastfeeding in public accommodations, or where they say that you can nurse your baby in public, and the only place that you maybe can't nurse your baby is in the privacy of someone else's home. That's a typical state law. Can you believe we still have to regulate this stuff? Come on now, you're feeding your baby. Anyway, but it is important to know specifically what applies to you based on where you live. Also, you want to plan for your separation from the baby. So pumping about a month out from when you plan to go back to work. So say that I'm say that I'm planning to go back to work in a month, so I begin to pump. And the best way to do this is try to incorporate one additional pumping session in during the day. My recommendation, because most women tend to have more milk, or their body makes milk more quickly in the morning, and then as the day goes on, their production slows a little bit. It's still adequate for the baby and everything. It's just how the body works. So the best thing for most moms is to pump immediately after nursing the baby in that morning feed. So you could begin to pump at that time once a day, and that would give you some, you'd be allowed to accumulate some for your baby. You could also pump a couple times a day, as long as that works with your breastfeeding and where you're at that time with your baby. Then you want to begin to offer your baby a bottle just a few times a week. You don't have to offer a bottle for every feeding or anything like that. That can really devastate breastfeeding. But you just want to start introducing that bottle so that that's something that they're familiar with and know what to do with. Then as far as storing your breast milk, so just to go over the storage guidelines, breast milk can sit out for 6 hours, just unrefrigerated. You can store it for 6 days in the fridge, 6 months in the freezer. Okay, so I like that rule of 6. That's kind of easy. It's helpful to remember that, easy to remember. So so when you're thinking about storing, you want to, if you have frozen milk, you want to use the oldest milk first within that 6-month period and rotate like that so that you don't have to waste any of that. That would be tragic. So definitely do some thinking on this. Come up with a plan early about what you think will work for you. Talk to everyone at work and school so that they're aware of your plan so that you can really be successful. A lot of moms get really concerned about, oh, what should I eat while I'm breastfeeding? As a general rule, there's no special restrictions for most babies. So just as a rule of thumb, a diet should be about 1,500 calories or more. And as usual, you should shoot for a wide variety of foods, regular amounts of liquid. So drink when you're thirsty. You don't need to consume huge amounts to make milk. Your body will do that for you. But you need to have adequate amounts of food and liquid. You'd also want to continue taking your prenatal vitamin, and the reason is that breastfeeding does take about 1,500 additional calories, and it requires more of a lot of vitamins and minerals. So you want to be sure that you're getting an adequate amount. Also, a lot of women are anemic after they've had a baby, or could be depleted in other areas. So it's just good as kind of an insurance policy. For specific allergens, so the most common allergen in a mother's diet is cow's milk protein. So the symptoms for this allergen in the baby who is breastfeeding would be blood in the stool. You might see eczema, which is a rough dryness of the skin. You might see fussiness or gassiness in the baby, and a diaper rash that just won't quit. It just won't go away no matter what you do. So the treatment for this is just removing cow's milk protein from the mother's diet, and it usually takes about 2 weeks or up to 2 weeks to get this out of the baby's system so that they're not experiencing any more of these symptoms. So that would be cutting out all cow's milk products. So it would be, of course, cow's milk, and then cheeses, yogurts, things like that. If you are drinking large amounts of caffeine, so that would be about 3 8-ounce cups of coffee or more, it can be difficult for some babies to tolerate. So especially if you have a baby who is preterm, or just a baby who is very young, or a baby who is ill, it's more difficult for them to metabolize caffeine well. So what you could see as a symptom in the infant is some irritability or fussiness, wakefulness, or that the infant is jittery. Now, if you suspect that certain foods are affecting your baby and you are concerned about this, a good idea to do is a 2-week elimination diet for any suspected foods. So what you could do is cut that particular food out of your diet for a 2-week period, and see if by the end of that 2 weeks, if the baby has had an improvement in their symptoms, and then you could notice that it might be, that particular food, so I'll avoid that moving forward. A few other diets that you would want to consider. So if you are a vegan or vegetarian, B12 is sometimes deficient in the vegan population because B12 is really common in animal foods and not in fruits, vegetables, grains, and things that vegans eat. So it is important as a vegan in general to be supplementing B12, and particularly for moms who are breastfeeding. If you are deficient in B12, this could cause, your baby could be getting an adequate amount of milk, but could cause some failure to thrive because it's lacking in B12. Vegetarian diets, usually you're getting enough B12, but if you're eating mostly just plant foods, B12 is definitely something to be aware of. Also, if moms are heavily supplementing with vitamins, you want to definitely watch the fat-soluble vitamins. Toxicity is a lot more possible with the fat-soluble vitamins because they're not as easily excreted as your water-soluble vitamins. So fat-solubles are your A, D, E, and K, vitamins A, D, E, and K. Also with alcohol, so there's always a question, hey, can I have a drink if I'm breastfeeding? So the key things to know about alcohol is that the peak alcohol levels in milk are about 60 minutes after consumption of that beverage. Okay, so it would take a while for your body to break down that alcohol and then for it to transfer into the breast milk. But it takes about 1.5 to 2 hours per ounce to metabolize in the adult. So it's just, those are considerations. So if you did want to have 1 glass of wine or something like that while you're breastfeeding, it would be best to have it probably while you're breastfeeding so that by the time that it's in your breast milk, that feeding is over. Of course, limiting it to 1 glass or less is a good rule of thumb as well, because alcohol is something that does transfer into the breast milk quite readily. It is important to have a basic understanding of the medication pathways during pregnancy versus during lactation. So in pregnancy, if a mother is taking a medication, it's digested by the mother's GI tract, and then it goes into the bloodstream into her major organs, including the placenta, and then it goes to the baby via that bloodstream. So essentially, in pregnancy, the baby is mainlining whatever the mom is taking as far as medications. In lactation, there's a few more steps. So the medication is taken by the mother, digested by the mother's GI tract, into the bloodstream to the major organs and to breast tissue. Then some of it, in some cases, is moved into the milk, which the milk is then consumed by the infant, then digested by the infant's GI tract, and then into the infant's bloodstream, into the infant's major organs. So you can see that because those additional steps are in there, it is different between what medications you can take while you're pregnant or versus while you're lactating. So the important rule of thumb that is, if you took it during pregnancy, you can take it while you're breastfeeding without additional risk to the infant. Okay, because of those pathways, you can see why that would be the case. Most medications are compatible with breastfeeding, with a few exceptions. Some medications might be compatible with breastfeeding, as in they won't affect the infant in any way, but they could reduce mother's milk supply, which is also a problem with breastfeeding. So 2 suggested resources for references on medications with breastfeeding is Dr. Thomas Hale's book of Medication in Mother's Milk. This is kind of the industry standard as far as reference material for medications in breastfeeding. And then there's you can actually get an app for your phone of LactMed, which is a publication of the National Institute of Health, and it has compatibility between different medications during breastfeeding as well. So let's face it, once you've got this beautiful baby in your arms, everybody's going to want to share this moment with you and snuggle that baby and give you as much support as possible. That's the ideal, right? So you have a lot of support systems, and it's important to identify all of them and think about some ways that people can help you out after you've had this baby. You are going to be busy. Breastfeeding alone is going to take up a lot of your time, at least in the early days. And then there's, of course, there's a lot of other things to do with a baby too. So some good support systems that you can consider would be your partner, family that you have nearby, friends, workplace or school colleagues, community friends, so via church or other community organizations that you're in, maybe sports clubs and things like that. And then your professionals. So I put IBCLCs, which are International Board Certified Lactation Consultants, which you can access at most hospitals and then in the community as well. So some lactation consultants are available for in-hospital visits or in doctor's office visits. Some lactation consultants like myself do home visits to make sure that moms are getting the support in that environment too. The really key thing with lactation consultants is make sure that if you're having any trouble in the beginning, you seek help and you seek it sooner than later. It's definitely more effective if you can get help early on and then hopefully be off on the right foot for your journey. So a really great thing that you should talk about, you and your partner, is 10 ways that a partner, family, and friends can support you with breastfeeding. So listing out ways that people can really assist you. So that could be anything from diaper changes to preparing meals for you, for your partner. It could be helping to clean up around the house or different chores or errands you need to run. Things like that. It's really important not to be worried or scared to ask for help. People want to help you, and this is a time when you really do need that extra support. Well, you've completed the course. I hope that you have found that it has provided you with valuable information and skills to use along your journey. I would love any feedback on what things you liked about the course, what things I can improve on, what things you want more information on. That stuff really helps me to build courses that can help all the moms and families out there who are interested in breastfeeding. So I appreciate your business and best of luck as you move forward on your journey. Take care.